Well, good morning, everyone. Thank you all for joining us for this fantastic presentation with Pacific Source Health Plans. Today, we're going to be talking about health insurance for nonprofit organizations. And we're really fortunate to be joined by a great number of folks who are here to help you and hear what you are wanting. So we're really excited to have this presentation. For today, if you could please put your name, your organization, and the region that you're in the chat box. That would be extremely helpful for us as we're going about this presentation. As soon as we have everyone's location in the chat box, we will be dividing folks into their specific regions throughout the state. That way, when we do breakout rooms, we'll be able to connect you with a sales executive that can talk with you more specifically about your needs as well. So super excited for that. And I'll go ahead and briefly do introductions. We have our two main presenters here with us today, one of which is Pedro. And Pedro is a sales executive for Pacific Source Health Plans. He got his start in health insurance in 2013, working healthcare.gov as a customer service manager, where he managed enrollment specialists who help people from 39 states enroll in health insurance. He then took a position working for a health insurance company, Mountain Health Co-op, as their sales executive. In his current role as sales executive for Pacific Source, Pedro manages individual and small group health insurance business in Southwest Idaho. He works directly with local businesses and brokers to help educate them on plans, benefits, network policies, and processes. In his free time, Pedro and his soon-to-be wife love to travel, be outdoors, and spend time with friends and family. Pedro also loves to golf and watching sports. His favorite teams are the Seattle Seahawks, go Hawks, Seattle Mariners, and the Oregon Ducks. But the roots for Boise State when they're not playing the Ducks. So thank you, Pedro. And then we also have his co-presenter, Eric, and he is a family man, outdoor enthusiast, and youth advocate. He studied accounting and business at Whitworth University and proceeded to move back to his birthplace, Boise, Idaho, to work in an intellectual, fast-paced environment, ensuring accurate financial reporting on business controls at KPMG. Eric was hired by his main client, Boise Inc., where he worked as an internal audit project management and was quickly promoted to controller. Passionate about the Idaho community, Eric Health Insurance was a natural fit. With the encouragement of friends and family, Eric purchased Frederickson Health Insurance in 2014 when he and his great team managed one of the largest independent employee benefit agencies in Idaho. In his free time, he loves skiing, biking with his daughters and his wife, Jana. He also serves on multiple boards dedicated to child development and health. Thankful for all his friends in business and the potato state, Eric makes sure Idaho-based businesses have access to best employee benefit strategies and options that uphold and strengthen position in Idaho. So thank you both, Pedro and Eric, for joining us.
Yeah, we're excited to be here. Thanks so much for that introduction, Garrett. We're excited to give this presentation, Health Insurance Made Easy for Nonprofits. We've got a lot of great information for you today, and we've don't got a ton of time to give it. So we're going to try to speak at a high level about a lot of these topics and really try to give you the information that we feel is important. But please feel free throughout the presentation to put questions in the chat. Garrett will be popping in to ask those questions and we'll address them. You can also save those questions if you'd like for the end. We'll be doing breakout sessions and assigning you directly to a sales executive that works in the area that you work. But please feel free to ask questions throughout. We really want to give you guys the information that you need and want out of this presentation. So I will get going. As you can see on our agenda, we've got quite an agenda for you. We'll talk a little bit about the history of benefits, why you should offer benefits, the basics of a benefit package. We'll go over a couple plan options. We'll talk about SHOP, which is a small business health options program. We'll talk about budgeting and getting your board to buy in, contribution strategies, value of a broker, and what it takes to implement this type of health plan. All right, so how did we get here? History. Prior to the ACA, which was created in 2010, every individual, every person coming to sign up for health insurance was medically underwritten. Didn't matter if you were an individual or if you were a part of a group. If you wanted health insurance prior to 2013, you were going to be underwritten. So depending on your health, what you were dealing with in your health journey really depended on what your rate was going to be. So really rates could vary tremendously for maybe someone that was to other folks that were dealing with or illnesses or whatever it may be. So health insurance looked a lot different prior to the ACA. Pre-existing conditions without prior coverage were not covered. So if you came to a carrier prior to the ACA, more than likely that pre-existing condition was not going to be covered unless you had previous coverage that was covering that ailment or that illness before. So you could see how that could be a problem for folks trying to deal maybe with the sudden diagnosis of cancer and maybe didn't have insurance before. So there were a lot of gaps and a lot of holes for folks prior to the ACA. There was also lifetime limits. There were limits on how much an insurance carrier would cover for your illness or your ailments in a given time frame. A lot of times there was $1 million limits or less or more, just depending on the insurance plan. So again, that could put folks in a tricky situation, especially again, someone dealing with cancer, maybe that cancer is recurring. If they hit their lifetime limits, they're going to be forced to go out there and find another company to give them coverage. Now, although they had prior coverage and their pre-existing would be covered, there could still be issues with how much that premium can cost that person by having to move to another carrier. Benefits were increasingly less common. And what I mean by that, mental health benefits, maternity benefits, even things like hospitalization and ambulatory services were not covered a lot of times in those old pre-ACA plans. You know, those plans were really kind of designed to really benefit the insurance company, maybe more so than to benefit the person that's buying the insurance. So prior to the ACA, there was a ton of things and a ton of barriers for folks. Now, since the ACA took 3 years to implement. It started in 2010, but they really couldn't get it going until 2013, which really speaks to the complexity of health insurance. But out of the ACA, we received a few different types of plans, metallic level plans, bronze plans, silver plans, gold plans, and platinum plans. And the idea behind this was to make it easy for consumers to identify the type of plan they were purchasing. As you probably can assume, the bronze plan is going to be more of a lower cost, higher deductible type plans. Silver are going to be more of those middle of the road, kind of mid-level deductibles, lower out-of-pocket costs. Gold is going to be obviously much lower deductibles, lower out-of-pocket costs, and platinum is even lower than that. Now, I will say there are not a lot of platinum plans available in the Idaho market. There are a couple, but most carriers are offering bronze, silver, and gold level plans. Essential benefits and patient protection. So like we talked about before, a lot of plans didn't include maternity, didn't include ambulatory services. Now, if you're on a qualified health plan, there are 10 essential health benefits that are covered. Now, I'm not going to go through every single one of them, but things like maternity, things like child wellness, prescription drugs, ambulatory services, mental health services, things that now we consider standard were really not standard prior to 2013. But now moving forward, if you're on a qualified health plans, there are 10 benefits that you can guarantee are within your plan. And then penalties. There is no longer an individual mandate. Prior to 2019, if an individual did not purchase health insurance, at the end of the year, the taxman would come along and issue a penalty if you did not purchase health insurance for 9 out of the 12 months. Now, as of January 1st, 2019, that penalty has gone away, and there is no penalty for individuals not signing up for health insurance. Okay, so why offer benefits? I'm going to hand it over to Eric, and he's going to take these first couple of slides here.
Awesome. Hey, thank you so much, Pedro. And it's a pleasure and honor to be with you all today. Yeah, so there are a whole host of reasons why we would offer benefits, but one obviously glaring thing that we've all come to know if you have had health insurance recently or currently have it, is if you look at the price tag of what it costs to be enrolled in a health insurance plan, it's very expensive. And and the graph kind of illustrates that for what we're looking at. So basically the lines that you're looking at on that spreadsheet, the ones that are lower on that graph our overall inflation, the amount that we have in terms of total earnings of what we're all making. But as you can see, deductibles and family premiums, the amount we're paying for this health insurance is greatly outpacing the amount what we're actually making in income as a country. As you can see, the dichotomy has changed quite a bit. And so that's a big reason why employers will offer insurance, is strictly because the amount that it's costing the employees now needs to be helped by the employer to be subsidized. So there are also many other reasons why employers will offer benefits. And I thought what might even make a lot of sense here is to share a quick story with you. Recently, we actually just were able to get the board on board, as well, and sign up the Idaho Nonprofit Center with their full, robust employee benefit plan. And through the whole rigmarole, it was really exciting to hear the feedback that we got from employees and Amy in regards to how we're able to enroll this. They picked a Pacific Source plan, offered a few different options, and allowed employees to pick which option fit them best. And what was really encouraging is some employees didn't have coverage prior, and they had lingering preventative care and physicals that they haven't done in a number of years. And so employees, because they now have employee benefits, they have health insurance through Pacific Source, they're able to have access and get all of those preventative cares done at no cost. So what it really did was created that peace of mind for employees to know that they can go see care and it's not going to break the bank doing it. So I really felt that it gave a sense of total, like, some peace and less stress in the office, maybe even less stress at home, because they know they can get those things taken care of. Other reasons to offer employee benefits, absolutely. It shows that an employer actually gives a rip about their employees. If you're providing benefits, it means that you care about not just providing a paycheck or making sure they serve your mission, but you're returning the favor and making sure that they're safe and that they're healthy.
You know, some other reasons as well to offer employee benefits is small group rate stabilization. The rates on the small group market have been much more stable than we've seen on the individual market. So much so that the difference between an individual premium and a small group premium can be somewhere between 20 and 30% difference. We'll talk to you a little later about how you can engage your employees to ensure that offering a small group plan is going to benefit them versus hurt them if they're on the exchange, because some of your employees may be going out to the exchange and receiving tax credit. So really what we have to do is take a deep dive to see if those employees are benefiting from being on the exchange, or if they would benefit from having a small group plan. And again, from the employer standpoint, those rates are much more stable and lower. So it really is beneficial from the employer standpoint to do that if it makes sense for their employees. Declining individual enrollment. Again, more and more small businesses are offering health insurance. And so what that means is less individuals are rolling through the individual exchange or Your Health Idaho. And that just goes back to what Eric was saying. You know, it creates a stickier employee. Employees are happier. And especially if you engage your employees in that process of offering health insurance and asking them what they need and what they want, that goes a long way in helping create a successful group plan. And then understanding the rates of small group versus large group. Small group rates are canned. Every year, all the health insurance carriers in this area are required to file their rates with the Department of Insurance. Once those rates are approved, those rates are the rates. They don't change. And so what that does is that creates a platform and for groups to really go out there and shop and not have to worry about fluctuating rates or anything of that nature. Versus the large group side where everything is still medically underwritten. If you're an employer and you're employing 51 plus full-time equivalent employees, there is going to be some underwriting. And if you are in that boat, I encourage you to reach out to us directly so we can have those conversations with you. So here's a nice little graph that shows the growth of the small group enrollment in the state of Idaho. You can see back in 2015, we had just under 30,000 people enrolled in small group plans across the entire state. And you can see today, as of 2019, because 2020 numbers aren't available, that has skyrocketed to over 60,000 people, more than doubled in 4 years. And again, that goes back to what we were just talking about, how it creates stickier employees, the small group rate stabilization. All of those things are a factor in why we continue to see membership growing on the small group market.
And I'll jump in here and say that it's amazing how many businesses that have 2 or 3 employees and maybe only one that's actually enrolling in insurance are enrolling with Pacific Source and other Idaho carriers just to take advantage of those savings that Pedro previously talked about.
That is a great point. Thanks for that, Eric. And that there's an opportunity as well. And that's why we really have to deep dive to determine whether individual is beneficial or small group is beneficial. Thanks for that, Eric. And then now we're going to move on to a basics of a benefit package. Eric.
Yeah, so benefit package, when we think of employee benefits, there's a whole host of things that your employees might want. Obviously, the meat and potatoes of health insurance or of an employee benefit plan is your medical insurance, commonly known as your health insurance, and then the dental and vision. That's typically what an employer thinks of: medical, dental, vision. That's normally what people do. But what an advisor like I do and other advisors in the Valley will do is we like to know what motivates not only the employee, but what also is mission specific for your nonprofit. Each employee base is a little different. Some are very interested in a vision benefit, where others would be more willing to put those monies towards a disability plan. Or maybe they're totally thinking outside the box and they want their houses cleaned, and that's what they want for their employee benefit. We, as an advisor, help you get to the root of what employees want, what will help them get motivated, and what will help them with their employee benefit package. So the way that medical works is we have individual medical insurance. That would be as if each individual person within the business purchased their own plans. Probably if you don't have a health insurance package now, that's what's typically happening. And we do help folks go through that. There are a lot of different intricacies that we can talk offline about that. Employer sponsored is what we're talking about today. That's their gold, silver, and bronze level categories, where you're based on age. It's not priced at all based on your health. And then finally, association plans. So the big hot topic of association plans has been that we can all get together maybe as a nonprofit association and offer one big association plan. The main issue with this is these all funnel through the Department of Insurance of Idaho, and the Department of Insurance of Idaho also has to approve this association. And this has been a big hurdle for our own Department of Insurance here in Idaho. They haven't necessarily accepted these associations to be common practice. So these really haven't taken a big step forward in Idaho. With that said, when you become an association, you are also rated on your health. And so they're always looking at demographics of certain businesses like Idaho nonprofits. Is that a healthier subset than the total Idaho subset? And those are things that we all weigh. So really the best places to get medical insurance for your nonprofit is if everyone purchased them individually and had their own individual plans, or what we're recommending, employer sponsored plans, doing it through a small group plan. Dental, vision, and life disability. These are all different products. Pacific Source has some really good options. Actually, when you sign up with a plan with Pacific Source, more often than not, they have a vision plan baked into it. So you don't have to worry about that. It's just already in there for you. And then dental, they have separate dental offerings as well. There's a few different players in the dental market, and it's all about matching need to benefit for your employees. And that's what, as an advisor, we do for you. So it's what also is kind of interesting about a benefit package is kind of when you think about what's included. Obviously, when you implement something like this, it's a decent sized chunk of change. You've got to, as a business, as a nonprofit, understand how much can I actually budget for this, and then what I can't budget, are my employees willing to pay for it? And one thing that we like to always think about is once you implement this benefit package, this is just another piece of compensation that you're giving your employees. So when you look at it at the end of the day, you really want to look at your employees' total compensation and definitely let them know about that. If they have a $40,000 salary, but you're paying an additional, let's say $10,000 or $15,000 in employee benefits, they don't have a $40,000 salary. They have a $55,000 salary. And it's really important that you let your employees know that. So There are a few requirements in regards to offering a benefit plan. I kind of mentioned it when we were talking earlier about employee requirements. The employee requirement to offer an employer plan through your nonprofit is you need at least 2 eligible employees to enroll in benefits. However, let's say one of those employees is over 65, is on Medicare, or they have coverage through a spouse. All you really need is 1 employee to enroll in benefits with 2 employees eligible. Also, insurance carriers like Pacific Source require that you have at least 50%, the employer contributes 50% of the lowest cost plan offered. That means that if you wanted to offer a few plans, no worries. You just have to make sure you're paying at least half of that. And really what we like to do as your advisor is back into that number for you. So you kind of look at your budget and see, what can I afford to do here? What makes sense in my budget that I can get through the finance committee and then approval. And then we back into that to make sure the plans fit your budget. Participation requirements is very important as well. Sometimes what will happen is if you have low contribution as an employer, you'll have employees, typically millennials, will say, man, I'm just going to roll the dice. I don't want insurance. I don't want to pay for it. That hurts a plan pretty bad, because if people waive for no other insurance, it can hurt participation. That's something that we work through as your advisor and make sure that it's a palatable option, that employees aren't doing that. And then finally, plan choice. We can offer a number of different plans. You aren't stuck on one plan. You basically would just work with Pacific Source, find what of the few plans that you'd like to offer, and then we roll it out to your employees and they get to pick what plan they would like to enroll themselves on.
Awesome, thanks, Eric. Okay, so now we're gonna go on to medical plan options. There are a handful of different types of plans that are out there. The most common types of plans are copay style plans and HSA plans. Copay style plans are first dollar coverage benefit plans. So what that means is you have benefits that are available to you before you have to meet your deductible. So copay plans allow you to see the doctor or get prescription drugs prior to meeting the deductible. I will, on the next slide, I'll show you kind of a side-by-side comparison. Health savings account plans, or HSA qualified plans, are only provide preventative services pre-deductible. Basically, the way these plans are set up, they're really intended to have a separate savings account attached to them. I highly recommend HSA plans when an employer is going to be contributing to that savings account, or where the employees are going to be contributing to that savings account, because that allows the employee to tap that savings account when they need to get services, because without it, they'll be they have to pay 100% of those costs up front. And so without a savings account, that all comes out of pocket. So there are some strategic ways to use HSAs. Obviously, that's one way if you're funding a savings account. Another way is to set that as your benchmark, a benchmark plan. Those HSA plans tend to be a little lower. And so sometimes, again, like Eric was saying, depending on your budget, you may need to back into it. An HSA is a good plan to look at as a benchmark plan. And again, these are conversations that we can go more in depth offline or after we have some more questions at the end of the presentation. So here are the two plans side by side. The two things to notice here is you'll notice the deductible is exactly the same. You've got a $4,000 deductible on the Silver copay plan and a $4,000 deductible on the Silver HSA plans. There's a couple key differences as I kind of touched on. One, if you look at the out-of-pocket max on the copay plan, it's $7,350. So that is the maximum a member would pay that is on that plan in any plan year. On the HSA side, you notice that that deductible matches that out-of-pocket. It's a $4,000 deductible with the $4,000 out-of-pocket. So you'll see how the HSA plan can be beneficial if you know you're going to have higher out-of-pocket expenses. The caveat there is nothing is covered except for your preventative services and preventative drugs. So on an HSA style plan, you are covering all of the costs. So let's say you get the flu and you need to see a doctor. Those doctor visits can range anywhere from $100 to $150. You will be paying for that, which we will apply to your deductible up until you meet that $4,000. Once you meet that $4,000, we start covering 100% of all in-network services. Now, on the other side of that, the copay side, let's say you get the flu and you're on a copay plan. As opposed to having to cover the cost at $100 to $150, you will pay a $30 copay and the insurance company comes in to cover the rest. You'll also notice there on prescription drugs as well, You've got co-pays on your tier 1 for $15, tier 2 for $35. That means that's your portion, depending on where your drug falls in, that's your portion of the cost, and we cover the rest on a co-pay style plan. So these are by far the two most common plans, with co-pay style plans being the most popular right now, because a lot of folks want to be able to receive benefits for something that they're paying. So co-pay style plans by far are the most common plans that are selected. You'll notice that at the bottom, Pacific Source is very unique. We offer a $500 accident benefit per accident. This accident benefit doesn't cover ailments or illnesses. It covers breaks, lacerations. Let's say you're on your roof and you fall off and you break an arm. We'll pay the first $500 of that claim. Now, if you fall down and you sprain your hand, that's not going to be covered. And again, that's a very unique benefit to Pacific Source, and definitely can provide more information on that if you guys have any questions.
And the other beautiful thing about that, those two plans as well, and I've said it a couple of times, is let's say you have half your employees that like the idea of an HSA and the other half that like the copay. Perfect. We can offer both of them and let them pick. And the other thing is, once you pick one plan, you're only locked into that plan for the year. Next year's open enrollment, that employee may want to move to the HSA. For example, let's say you're planning on having a baby next year. As an advisor, I would advise that person to move to the HSA versus the Silver Copay plan, because they cap their total out of pocket at $4,000 versus the $7,350 on the copay plan. And so what we'll have is we'll have employees that will go on that plan, have a baby, cap their costs at $4,000, but then the next year they can enjoy a copay plan where they can just take care of the routine doctor visits and prescriptions.
Really great point, Eric. Yeah, the offering multiple plans is such a big deal. Again, it really helps you and your employees get what you need out of the health plan. All right, so let's not forget there are other important benefits. We have a separate entity, Pacific Source Administrators, that's different from Pacific Source Health Plans, that has an array of great products that can help your business and make sure that you're getting the most out of your health plan. I'm not going to touch on all of these. I'm just going to touch on a couple. Obviously, they have excellent customer service and competitive pricing. Starting in 2021, Pacific Source has embedded premium-only plans into all of our small group plans. Premium-only plans allow your employees to pay their portion of insurance premiums with pre-tax dollars, helping them save some money and get more money on their paycheck. It also allows you to pay a lower FICA and other payroll taxes. So premium-only plans are really important, and with Pacific Source, those are now included at no charge in all of our small group plans starting in 2021. Obviously, we also have health reimbursement arrangement accounts, COBRA administration. We can help you set up flex spending accounts for your employees. FSAs allow you to save payroll taxes while giving your employees the opportunity to increase their take-home pay. So there's a lot of different unique things and other important benefits that are out there. And again, if you have any interest or any questions on this, we are more than happy to answer those questions for you.
And I'll jump in here a little bit, Pedro, as well, and say that with those flexible spending accounts, what I found with a lot of the folks that I work with in nonprofits is they have children who are, that they have, and they're spending a lot of money on daycare or daycare type services. An employer can offer a benefit called a daycare, like a dependent care flexible spending account. It's basically they can pay for their daycare pre-tax, essentially through their paycheck, or you can even contribute a portion of that if you want as an employer to help cover those really expensive daycare needs. And so that can be a really nice benefit to tack on if that's a need for your business.
Thanks for that, Eric. Okay, now on to SHOP, Small Business Health Options Program. This is a huge program and really beneficial to nonprofits. So what does SHOP do? SHOP helps small businesses and nonprofit organizations provide health insurance to their employees by providing a tax credit and a reimbursement back to the employer who provides insurance to their employees. Some examples of how SHOP helps with affordability: they provide tax credits for payroll tax. They can, for nonprofits, you can be refunded up to 35% of the contribution that you pay in. So let's say in a given year, you pay $10,000 for making this easy. You pay $10,000 in premium for the entire year. you can qualify to receive up to $3,500 of that back in the form of tax credits. And imagine what you could do with that extra money. You could provide dental coverage, you could provide vision, life, disability, maybe fund a flex spending account. Like Eric said, there's a lot of things you can do with these savings. There is a calculator that's out there. Here's the link, and we can also send this link out as well to everybody. It's 6 questions, and you answer those 6 questions based on your employee's full-time hours, how many part-time you have. There's a few other questions on there. You answer those questions, and it can give you an estimate of what you can qualify for and whether you would qualify at all. On this next page here are the qualifications to qualify for those small business tax credits. You have to have fewer than 25 full-time equivalent employees. Your average salary for those employees has to be $50,000 or less per year. You have to pay at least 50% of your employees' premium costs. So like we talked about contribution, you have to pay at least half of the employees' premiums. And then you have to offer that coverage to all of your full-time employees. So most of us are going to check the box. Most of the companies on the nonprofit are probably going to check all these boxes. So there are a lot of opportunities for nonprofit organizations to receive tax credits back for providing health insurance to their employees. SHOP is easy in Idaho. We are very lucky that it is so easy in Idaho. In other states, it's a little bit more complex. But in our state, to enroll in SHOP, all you have to do is find a YHI certified broker. Eric is one of those, and so am I. So you go to YHI, you download the application, you complete the form, you email or mail it in back to YHI. They put their stamp of approval on it, send it back to you. You keep that form. At the end of the year, you go to your tax accountant, whoever does your taxes, you give them that form, and they do the rest. Once you're approved, though, all you do is you go out there and shop for insurance, you pick a plan, and at the end of the year, those tax credits can be assigned through your tax accountant, and they'll figure out all the details on that. But SHOP is really easy. I encourage groups all the time to take advantage of this program. A lot of groups are leaving money on the table, and like I said, in Idaho, it's so easy to get that application submitted, to get it approved. So highly encourage you to bring that up or have those discussions with your advisor. All right, now on to budgeting for benefits, planning, getting buy-in, and sustaining a benefit budget. So creating a budget. So from the insurance carrier standpoint, we need some information in order to get you some numbers. So if you want to quote to figure out how much health insurance is going to be for your employees, there's some things we typically need in order to get you those numbers. Now, again, those rates are canned, but we want to provide you those rates, and we need a census with name, date of birth or age. If you're going to be adding any spouses, dependents, children, we'll need their information as well. Gender, zip code, tobacco use, and data hire. Those are things that they have asterisks by them because some carriers require them, some don't require them. But the basics of what we need are your name, date of birth, your relationship, and we're able to get you some numbers. Eric's, I believe, going to talk about how you can use an employee survey to really engage those employees as well.
Yeah, kind of a good first step when you're creating your budget is to really get your employees' feedback in terms of what they want to see out of a budget. And we've developed a really nice survey monkey, if you will, that asks them, that is branded to the employer, that asks a lot of different pointed questions in regards to what type of benefits an employee, just, knee-jerk reaction would most likely be interested in. Once we gather that feedback, the employer and I can look at what benefits would be the best fit, so we can gather kind of an estimated ballpark of what benefits would fit within their budget, but would also be make the employees excited. So it's really key to understand not only what benefits they want, but what hospitals they currently use. There are a lot of benefits that use different hospitals. One of the advantages of Pacific Source is you may have an employee who goes to both St. Luke's and St. Al's. That's just fine. They have plans that have that, but also if you have the majority of folks here in the Treasure Valley, for example, they all pretty much go to St. Luke's. You can also offer a lower cost option that kind of carves out the St. Luke's hospital, which can be a really nice benefit from a cost perspective. So those are good ways for us to identify and help employees land on, and employers land on the right place. The other thing to do is creating the budget. Obviously, most of you on the call today have finance committees. Maybe you're an executive director and you're trying to make sense of this all by yourself. Either way, that's totally fine. Based on implementing a few different benefit plans for the boards that I serve on, really it's obviously getting the board on board first. To make sure that they understand that this is something that you as an organization would like to start to offer and kind of put it on their radar that this is something you're thinking about. So a good way to create a budget for how much benefits would cost if you didn't want to do an employee survey first is you can look at all of your full-time employees. So typically full-time employees, the maximum by federal law that you can have is 30 hours per week. You can't bump it up to 40 hours a week to make them eligible. So basically anybody who works 30 hours per week, and this can really be looked at an annual basis. So if you have a really busy season, but kind of a slower spring or fall or whatever, if they're averaging 30 hours per week, then they're considered full-time eligible. We can lower it down to 20 if you are wanting to put more employees on there. And so you take their average wages for that amount and you essentially say, okay, of those full-time employees, their wages are so much money. You take 10% of that and that will pretty much land you where benefits will cost you for a total cost for benefits for your business. The other thing to think about obviously is to back out any ability for shop credits as well. So if your budget, maybe it's $10,000 per year, but $5,000 or $3,500 of that is going to be covered in shop credits at the end of the year, we'd want to take that into account to make sure you're getting all the bang for your buck. The other thing that I talk about, and I a little mentioned it earlier, is getting your board's buy-in. Involve the board and the finance chairs early in the discussions. Let them know that this is something that you think would help as a benefit to attract and retain key talent. And start your planning early. Right now we're in September, if we can believe it already. So this is a perfect time really to start talking to your boards. Most boards right now are starting to think about your budget for the 2021 season. So please make sure to start maybe having those conversations right now, and you can build it into your next year's budget. Really good way to get that done. So in regards to contribution strategies, there's a couple ways that you can contribute to health insurance and employee benefits. A lot of businesses will do what's called defined contribution. So essentially what defined contribution means is you're going to say, look, we're going to give each employee $400 and they can use that $400 for whatever they want. So let's say they have health insurance, they want to buy health insurance and they want to buy dental and vision, but their total bill is $500, but you're only contributing $400. That means the extra $100 there is going to come out of the employee's paycheck pre-tax. That's a really nice way to do and makes it very simple for employees. And when you have new recruits, to help them understand what their cost would be if they joined your nonprofit. I really like this way of doing things from a simplicity perspective. The one major downside, as Pedro talked about earlier, is on the small group world, so 50 and under, all of our pricing is based on how old you are. Doesn't matter how sick or healthy you are, it's all about age. Doesn't matter what gender you are, it's just age. And so what happens is if you have a 20-year-old on your plan, but you also have a 50-year-old, those are going to be significantly different costs for the same plan. So if you're only offering $400, or if you're offering $400 per employee, that $400 stretches a lot further for a 20-year-old than a 50-year-old. To mitigate that, what we do is we create what's called a composite rate. So every employee has the same rate rather than being based on their age. So we basically take all your employees that are enrolling and then calculate a composite rate so you can do a defined contribution. So that's kind of what we have to do if we're going to go defined contribution. What a lot of employers that we see do, just to make it simple and more equitable, and they just want to keep the cost based on the age, is they'll do a % of premium. So an employer will say, look, we're going to pay 75% of the health insurance premium for the lowest cost plan. And so each person's rate will be based on their age, and we do a simple math calculation that we run through our online enrollment tool that allows the employees to easily calculate how much insurance will cost them if they chose a certain plan. The upside is it's a fair way of doing it where everyone gets the same percentage paid. The downside is the complexity. So if you don't have an advisor that has an online enrollment tool, or you're trying to pull out the old handy dandy calculator and calculate this, it's easy to go cross-eyed with all the different numbers and scrolling to certain people's ages and doing different things. So we really do try to lean people towards defined contribution, but a lot of the time, percent of premium is just easier for them, and we'll create a spreadsheet for that.
And of course, we'll work directly with you to see what's going to work best for your business. So when we're going through these conversations and you're wanting to set up a health insurance plan for your employees, these are definitely conversations and questions that we'll be asking to see what's going to be the best fit for you and your organization. Thanks for that, Eric. Now I want to talk to you the value of a producer. So I want to talk to you about the value of using someone like Eric, who's an independent agent. They represent all carriers. You know, I'm work for Pacific Source directly, so I'm not going to sell you a Blue Cross. I ain't going to sell you anybody else. I'm going to sell you a Pacific Source. I'm going to work with you to get you on a Pacific Source plan, where Eric really represents all of the carriers. They present the best options based on needs. And you know, we will too, obviously. Even if you did come to me directly and you were working with me directly, you know, if we're not a right fit, we're going to be honest with you. We would never want to sign you up with something that wasn't going to be a fit for you and your employees. We do think, though, that we have a fit for everybody with our plan design, with our benefit design, with the way we put our networks together. We think we're a fit for everybody, but obviously that's not always the case. And we definitely encourage the use of brokers for this very reason, to ensure that you're getting that independent representation. They help educate employers with best practices, kind of like what we've been doing today with kind of educating you on how to get a plan going, how to budget for it. Those are the type of things we do day in, day out. And again, they're just a resource. I mean, again, they represent all the carriers. They know the ins and outs of how each carrier works, what's required to get a plan enrolled, all those sorts of things those little details are going to pop up during enrollment. So really using a broker is really key to helping you, especially if you're the administrator and you're going to be the one kind of managing that plan on the employer side. Having a broker that you can go to, that you can trust to answer questions, to get information. Maybe an employee has an issue with the claim, whatever it may be, having that broker to go to bat for you, to be that advocate and that between you and the carrier is really big. So at Pacific Source, we highly recommend and encourage our groups to utilize the broker. There is no cost to you. It is free to use a broker to you. We actually pay the broker to help you. So there is no cost to you. So we highly recommend and encourage that you use a broker. It's just going to provide you the support when you need. They're going to provide you the information you need. And again, when there's a hiccup or there's a problem, sometimes it's kind of nice, especially if you're busy, to kind of pass that issue off and say, hey, Eric, you know, I'm dealing with this issue. A couple of employees are dealing with some claims problems. Can you help us out? And that's going to help you save time, help you save money, so you can focus on your business and keeping your employees happy. So we can't say enough about the value of a broker. All right, now we're going to talk about implementation and beyond. Go ahead, Eric, I'll let you take off here.
Great, thank you so much. Yeah, so timing is everything, right, in the world. So in regards to where we're at right now, 90 days is a good time to start thinking about what you want to do for employee benefit plans. So it's a good time to provide us your census, so the names and dates of birth, and any dependents' names and dates of birth that you'd be interested in covering, or that you're interested in covering. This gives us time to review the options, prepare plan options for you to review, and kind of make some decisions on where you want to go. From there, it's 75 to 60 days. You can present that to the board on what options you would like to offer as an employee benefit plan. And then 60 days out, that's a great time to begin the enrollment. So that's when we would push out our online enrollment or paper enrollment, whatever is better for your business. We would gather all of the information from the employees, submit those over back to the carrier for a final quote and approval. From there, we would be able to get a bill from the carrier, or what the estimated cost was, and then you would prepare payment. We'd submit that in ideally 30 days prior to the renewal, and that gives the carrier time to make sure there's no issues with the plan, make sure there's no issues with any information provided, and they can get cards out, ID cards for the different benefits to employers prior to the start of the plan. Now that's the ideal world. And that's really what we shoot for. There's a lot of time things just don't happen that way in regards to people's schedules and timing. If you, for example, needed a plan, if you were needing a plan October 1st for your business, I just did it this morning. We will absolutely help you and your nonprofit sign up for benefits effective the following month. So really, we can squeeze this 90-day process into a week or a 2-week kind of crazy fest, if you will. We can absolutely do this, but in regards to making it good timing for everyone, we really like to start 90 days out. But don't let that scare you. If you needed to have something done quickly, we can make it happen for you.
Yeah, and that does happen often. You know, a lot of times employers will come in last minute. And again, things are busy, things happen. And so, yeah, again, week, 2 weeks, it's definitely something that's possible that we can get you enrolled and get you in the system and what you need. Now, sometimes from the carrier standpoint, what I'll point out is ID cards can be delayed. So, you know, one of the reasons, Eric would say 30 days advance to get this information is because ID cards can take 7 to 10 business days or more to be delivered. So if you come in, the last week of September for an October 1st effective date, your ID cards aren't going to arrive in a timely fashion, right? They're going to take an extra week or so to arrive to you. Now, we will be able to get you temporary ID cards once you get into the system. But just one thing to keep in mind, if we are coming in kind of last week or last minute, there could be just some delays on things. Now, again, you're still going to have coverage. You're still going to have those things, but just something to be aware of.
Perfect. So implementation and beyond. So the value of open enrollment meetings. So one thing we didn't present in that 90-day window was when we do open enrollment meetings for your employees. There's a statistic that basically shows, and it was created by Kaiser, a big hospital chain out that does everything down in California and elsewhere. And they did an analysis where they looked at employers who offered 80% better benefits than like their competing markets that they work with, but they didn't explain it very well. Like they didn't show people what their benefits were. That they found that 80% of the employees had a negative perception of the benefits being offered. Conversely, employers who really are below market in terms of what they're actually offering on benefits, like maybe they're not contributing enough or their plan really isn't very good, but they're actually communicating it and pushing it out and letting employees know what they have. They have found that those employees, 80% of those employees actually think that their benefit plan is great. And really what that all comes back down to is the value of what an open enrollment meeting and the value of communicating your benefit plan to your employees. So that's a really big thing. If you can let your employees know what you're paying, what not only the amount of money that you are contributing as a nonprofit for them to have health insurance and employee benefits, but also what benefits they get, it really goes a long ways. What's really easy to forget, like what Pedro said, is when you sign up for Pacific Source, if you twist your ankle and you spend some time at Direct Orthopedic Care, Pacific Source is covering the first $500. If you don't know that, I mean, you might just think that your plan's kind of garbage and you don't like it. But at the end of the day, Pacific Source is picking up the tab before you even have to walk through the door. So there's some really cool things, and it really can drive a greater appreciation for what you're offering, but really what the benefits are.
And that would be a break, not a sprain, remember.
A sprain. I'm sorry. Did I misspeak?
A break, yeah, not a sprain. Yeah, break, not a sprain. We cover breaks, lacerations, yeah.
So, yeah.
Yep. All right, let's see, where else are we at? Managing your plan, online enrollment platforms.
Yeah, so I mentioned online enrollment platforms a couple times so far. Online enrollment platforms are really nice, especially in today's age where we're all cooped up in our homes or we're not as intimately working with each other. This is a really nice way for a nonprofit to allow their employees to log in from their own computer or their work computer and be able to view their benefits, pick what benefits they want, and make sure that they can navigate what benefits that they truly have. This also is really nice for a group administrator as well, the person who's kind of managing the plan. This might be the executive director or a bookkeeper, or if you're a large enough nonprofit to have your own HR person, they can manage and look at all the employees, add and delete or terminate employees when they need to, and it gives everything a really nice, seamless process. The other thing that I'd like to talk about in managing your plan, one area that once your plan's up and going that can get nonprofits in trouble is reconciling your bills. So what can happen is if Pacific Source if Pacific Source and your advisor aren't told that you had an employee quit or you terminated them, they're going to continue to cover them. They're going to continue to bill you for them until you let them know. What can happen is if an employer doesn't reconcile their bill on a monthly basis, they can find that they can have some of these employees on 6 to 8 months. And then it becomes an issue trying to get them termed back, especially if that employee who was terminated was using those benefits. I'll tell you a quick story here. And this doesn't just go for the small nonprofit here in Idaho. I have a friend who was the benefit advisor or is the benefit advisor for Hawaiian Airlines. And they had a snafu within their open enrollment platform where they didn't terminate people for 8 months off of the Hawaiian Airlines plans. And this was a few years ago. And it was finally realized by like an audit that they did on the advisory side that they haven't seen any terminations so it became a massive issue. And so it's not just something for small employers to worry about. So we make sure that as your advisor that you're doing these reconciliations and that you have a process to make that work.
Awesome. All right, so and if you want to know more, Eric and I are available. Again, Eric Fredrickson, owner of Fredrickson Health Insurance. He's a benefit advisor, operates one of the largest independent health insurance agencies in Idaho. There's his email and phone number. Again, I'm Pedro Rojas. I'm the sales executive for Pacific Source Health Plans. My phone number and email address are found there as well. We really, really appreciate your guys' time. We look forward to answering any questions you have. I believe there's going to be some breakout sessions that we'll be doing here shortly. Be sure, as Garrett mentioned, to put your